she started her cycle and she wanted to start getting pregnancy attempts again. I go, okay, I wonder what her fibroid sizes are now. They're going to be huge.
Yeah.
So she's in. I talked to her. I said, well, let's do an ultrasound. And she said, yes, I want to see what my uterus looks like. Didn't tell me anything. And so I'm doing a vaginal ultrasound, and I'm like checking my machine.
I wonder if
checking
she
what's
had...
going on. I'm going, I looked to see if she had a scar on her abdomen before I said anything else, and she didn't. And then I'm really totally, completely wondering what the hell happened. I said, have you been doing anything the last 6 months, 8 months? She said, yeah, I finally decided to go see Dr. Nee. I said, you've got to be kidding me. I said, I cannot see a single fibroid. I said, your uterine muscle is completely normal. Your uterine size is completely normal. And I said, thank you for going and doing that. And we went on. She got pregnant.
So you said that the herbs that he used were estrogen suppressant, probably.
I'm assuming that's
right.
what he did. I called him. As soon as she left the room, I got on the phone and I said, Dow. I said, it's unbelievable. I told him our size. I said, yeah. I told her I thought she was okay now. I said, she's not only okay, I can't see a single fibroid in her uterine muscle. And he goes, well, that's a good outcome.
Yeah, he's very humbled and very,
right.
Very cavalier about it all. Yeah, it's interesting, these outcomes. It's the combination of the patient's willingness, right? She had to trust you, and then she had to go and meet him, be poked with needles, take home bags of stuff that looks like potpourri,
right.
and then smell up her house and cook it, because I'm sure it was raw herbs at the time, and the commitment that she had to make, right? But that is under the umbrella of patient empowerment. Yeah. And that's where we have, this is what my doctorate was about, the combination of what science can do as IVF and what the acupuncturists can do with herbal medicine, endorphins, and stress reduction. But it's the patient who, like you said, are the pioneers. They're the glue. They're the people who are building the bridge. They're the ones that are helping us to understand one another, because we are in our own lanes doing our work and so busy, hardly ever anymore do we have a chance to say like, hey, this is happening over here or whatever. Like, some of us communicate, like you got on the phone with Dow, but it's through our patients coming back and giving the information. Mostly we get the information of the follicle count,
right.
what they're working with, their labs, and then we go to the pharmacy, we figure out with our 400 bottles of herbs, like what kind of concoction to make for them. But if they are willing to take it, then we can see these kinds of outcomes happen.
The other thing that has really impressed me even more so with traditional Chinese medicine is what your program does with the seed program. It's that and more. And patients, to me, the ones that I've seen a complete turnaround with are the ones that are so anxious and so stressed that I can barely have them listen to what I'm talking to them about, because they're so...
Would you say upregulated?
Extremely. And nothing I can say to them
penetrates,
can bring them down.
Yeah.
And I'm pretty good at that. But once they've agreed to go into your seed program, they're a totally different person when I see them again.
They may not even ever meet me if they're doing the seed program, because it's international now.
Some of them have done it
in different
virtually.
It's in 14 countries around the world that we have reports of women using it now. So it's not that I'm just nice to them or wiping their tears. It's giving them an instruction manual of things that they can do to think differently, to down-regulate their nervous system. So,
and I think I've got so many examples of those patients over my career, And, you know, a lot of them will come in and say, I need something for my depression. I need something for my anxiety. And in the old days, I used to say, okay, well, we can try this medicine, or, need to go see a psychiatrist. And they go, no, I can't. I don't want to go. And I got to the point where I didn't even offer that anymore. And what I started saying was that I can give you a medicine, but it's going to have all kinds of side effects. And yes, your anxiety level may go down, but you're not going to like the side effects in your life of taking that medication. The same with antidepressants. And I've convinced them to look at a more natural approach. And I really do strongly believe that. I will take anything other than a medicine with the side effects if I have a choice. Now, that's just me personally. And so I don't take medicines per se. But if I need some, I've done acupuncture. The herbs.
The
capsules are fine.
Yeah,
the tea
we now have it in little packets of granules, so you can just pour it on your tongue like Pop Rocks. The compliance on that is good. Yeah,
I could do that.
Mm-hmm.
But so, it's the side effects that patients deal with, and even the side effects of our medicines that we have to use, and they're natural FSH and LH products or recombinantly produced. So there's very few side effects, but the effects of stimulation, the high hormone levels, they have to deal with those side effects. And so it's just every time I mention about using traditional Chinese medicine, some eyebrows go up and I say, that's a natural medication. And most people will then bring their eyebrows down and listen. And because that's what they want, and that's what I want them to have.
Mm-hmm. There are a handful of fertility cases that I'm working with who are taking mood stabilizers. Mm-hmm. And the way that I see that is that it kind of limits them where they can't get too much joy anymore. They can't get excited, but of course they're no longer feeling so depressed and triggered with anxiety. So it's good, but in Chinese medicine, we teach that the uterus is the second heart. So if they can't tap into joy, that's a problem, because we need them to be able to go beyond those ranges and to express the tears. So the way that the Chinese medicine can work, the herbs can just expand this range for them where they feel more balanced, which is such a buzzword, but we know when we are balanced by how we feel when we're out of balance. And so I think our goal as the alternative part of the team is to help them stay as balanced as possible. So
no matter what kind of Western medicine that is used for mood stabilization, anti-anxiety medications, it blunts their ability to react. And that's why they use them, because they don't want the deep depression or the high anxiety, but it's blunting. And what you're trying to do is always going to have a limited effect when those are in combination, I believe.
Yeah.